women were historically diagnosed as histrionic. If they were excited or upset, we did not deal with their stress or anxiety or depressive state, but we categorized them as being histrionic. So that put them in a special category. So their depression and anxiety wasn't dealt with. So the longer that you have that extended, neglected mental health issues, you're more likely to move in the direction of doing some, finding some resolution for yourself. Feeling a sense of belongingness is one of the factors that we see, risk factors for suicidal ideation in females. Wanting to belong and having a sense of being a burden to others. So I'm going to resolve it. Most people, I think it's been mentioned, when someone decides to end their lives, it is sort of a resolution, and sometimes it brings them some peace because I finally made a decision about what's going to happen at this point. So we have to be careful about the misdiagnosis, particularly in these groups. Less treatment. We know there's been lots of recordings of providing less medication to people of color when they do present with anxiety or depression. There's this notion about people of color being stronger, particularly African-American women. We're super women. That's not true. I like to have myself taken care of as well. So we have to pay attention to those perceptions that are still persisting, that impacts all those other social determinants. And my favorite story is to tell the one about Serena Williams, who had blood clots. And it was ignored when she had a child. Now, here's a woman with all kinds of economic resources. So it doesn't matter if you have the economic resources, it's the perception of who and how you're seen that makes a difference in terms of the kinds of care you get and the diagnosis you get and the treatment you get. And to piggyback, Lisa, on what you're talking about in terms of statistics, we see a rise in suicide. It's higher in men than women, of course, nationally and elsewhere. We've seen a rise, however, in African Americans, males. We see a higher rise in Asian Americans attempted suicide. So, and we don't have enough statistics for the last 2 years. So I suspect we will see an increase across the board. For white males, it's been higher if you're 85 years or older, but we do see an increase between the ages of 34 to 65. And for most categories and populations, we see an increase in those areas, but a major increase, upwards of 18% for adolescents, for Blacks and Asians thinking about suicide. It has increased. So we see, as you mentioned, all of you, Abby, I think you mentioned too, in your education, you see that adolescents are looking for alternatives to handling this lack of belongingness and feeling a sense of burden and not being able to communicate. Because my concern as a clinician, I discourage people using their phone to communicate. If you're saying you had a whole conversation with a person and it was on the phone, you didn't, you're missing the verbal cues that comes along with conversation. And I think we have a generation of young people who are missing out on the tactile experience and the physical experience of communicating. And that's a huge piece to go forward in your adult years, not having that experience. So I think it's something that we need to address. So those are the major concerns in terms of how we're going to move forward to be able to address it in terms of encouraging people to have real communication with each other.